So let's be clear. The president is not your patient, right?
That's right.
I'm just confirming.
Yeah.
So, but his doctors believe that the president does not have a new case of COVID. So is that correct?
That's right, Ed. Backing up a bit, we know that the president tested positive for COVID on July the 21st. He then started Paxlovid and he tested negative 6 days later on the 27th, but then tested positive again on the 30th. So we've seen this in some patients who take Paxlovid. It's their symptoms resolve, they start testing negative, but then they can rebound with a positive test, and they might even have symptoms. It's not common, but this isn't rare either.
Mm-hmm.
Yeah, President Biden says he's feeling well, but that, a rebound case of COVID, it must be frustrating nonetheless. He's isolating again. Why is that important?
You're right, Erica. I can't imagine how frustrated patients who are rebounding are, especially after they test negative. But it is really important that they isolate, since anyone who is who's shedding enough virus to test positive on one of those rapid antigen tests, well, they're also likely to be contagious. But the good news is that patients who get these rebound cases, they don't develop any more severe cases.
Mm-hmm.
They generally do fine, but they might have some symptoms and still need to isolate.
Dr. Raja, let's talk about Paxlovid a bit here. You've said many times that the drug is very effective in preventing severe illness and death, especially in high-risk patients, and the president qualifies in one of those categories because he's an older man. Have you seen any data yet that changes your mind about Paxlovid?
I really haven't, Ed. No, Paxlovid still works well for patients at high risk of developing severe COVID. The problem is, quite honestly, that there are many people who are young, vaccinated, otherwise totally healthy, who really aren't at risk of developing severe COVID, who are taking Paxlovid now. And I worry about that, both because of rebound cases in the population, but also potential resistance when we have a lot of people taking a medication that don't have the indication for it.
Mm-hmm.
Yeah, well, you just spoke to what I was going to ask you. Massachusetts has one of the highest vaccination rates in the country. Some patients with a new infection may think about taking Paxlovid. You just talked about some of the reasons perhaps not to. So what do you really want them to know?
Erica, I really want to emphasize that if you meet the criteria for taking Paxlovid, things like age, asthma, cancer, other illnesses, all of which can be found on the CDC's website, if you meet those criteria, definitely talk to your primary clinician about taking it, and they'll review your medications because there's interactions between Paxlovid and other medications. And if they say you should take it, you should absolutely take it. But if you don't meet those criteria, and you're thinking about just taking it because you want to be extra cautious, please don't. We should all only be taking, and quite honestly, we should only be prescribing medications when they're only really indicated.
Dr. Raja, thank you for your expertise and your advice. Great as always to talk with you. Take care.
Thanks, Ed and Erica.